All right, now we're going to get to the nitty-gritty about the procedure. So, Derek, can you explain your experience with the procedure, kind of from start to finish, just an overall kind of bird's eye view of things?
Sure. So when you come in, they basically, like I said, you do meet with the SmartGraft professionals and doctor at the same time, and you come up with a plan, which makes you feel really comfortable because you're like, it's your hairline, you're creating, potentially a new hairline for yourself. You really want to make sure that you're getting the desired look. So my consultation was very thorough, and they actually mapped me out and drew me out and showed me exactly where they'd be taking from, and exactly how it might look in the future. I was one of the patients that, like I said, it wasn't really bad. I didn't have a ton of loss. So I had one of the smallest follicular transplants that they've done. I've only had like 700, which is very small.
Okay.
And the day that I came in for surgery, you're not under anesthesia in any way. It's actually it's called tumescently numbed. You're topically numbed.
Okay.
So it's injection, but it's not a painful thing. And basically, they just get started on creating your hairline first, and then they move you onto the back of your forward facing down. It was about a 5-hour procedure, and an FUE, in case you're someone who's new to the SmartGraft, what they are able to do now, instead of cutting strips out of the back of the head like they used to do, leaving big scars here, when I had it done, they individually just took hairs out of the back here, so I have
you would never know.
I have no demarcation. So it's a little tool. It goes in, it grabs an individual hair, and then these are not subject to hair loss. So then they go in and then they replace in those areas. So when they're mapping out, they're mapping out where to safely take from and where to put. So that's kind of your longest, creating those things when you're meeting with them at first is kind of your longest part, and then the procedure itself is pretty long. Some people are, if you're an anxious person, I'm not. I'm very familiar with procedures. Some people are uncomfortable with even being in a doctor's office. So we provide a lot of other things. If it is, there are sedatives, and there's also Pronox that we have, which is a laughing gas split. I did not take any of the sedatives. I was just numbed, and with our team, talking me through it and being comfortable, the 5 hours went by really fast. It really did.
It's nice to know that there's options.
There are.
Because understandably, you could be a little bit, nervous about it.
You could, and we're lucky enough that we are an ambulatory center with all different methods of making somebody comfortable. So it was a comfortable procedure for me. It's a little freaky, but it's you just don't look.
Beauty is pain sometimes.
I just wanted those hairs.
I
didn't care what was going on. Just put the hairs in there.
So you said you had about 700 grafts, which is on the lower end. Okay.
Yeah, I would say the average. So if somebody's curious and they want to look into SmartGraft or FUEs, a standard CD size, like say male pattern baldness on the back of the head, would be a 2,000 graft transplant on average. And they're taking it all from this area, and what happens is once they take that, it is such a finite little drill that it just closes. So you don't look like, you could see my head, you can't tell any difference whatsoever. And then they take that hair that's not subject to the DHT loss, and they replace it into a little slit that they make all over in the scalp, which we'll post some of those pictures for everyone to see.
And that's interesting to know that even if you are doing a larger area, the other hair that you already have is really not going to be
it's not really
affected
because you have
in the long term.
thousands and thousands of hair in that.